Epilepsy is a neurological disorder characterized by recurrent seizures, resulting from abnormal electrical activity in the brain. This condition affects millions of people worldwide, making it essential for medical professionals to understand the various aspects of epilepsy. In this script, we will delve into 12 topics related to epilepsy, providing detailed information on each subject. These topics include epilepsy genetics, ictal and interictal SPECT imaging, autoimmune epilepsy, temporal lobe epilepsy and hippocampal sclerosis, polytherapy and epilepsy management, psychiatric comorbidities in epilepsy, epileptogenesis and epileptic focus, ketogenic diet and refractory epilepsy, epilepsy and sleep disorders, neurostimulation techniques in epilepsy, febrile seizures and epilepsy risk, and epilepsy and developmental disorders such as autism and tuberous sclerosis. By covering these topics comprehensively, medical professionals will be better equipped to diagnose, treat, and manage epilepsy patients effectively. Now, let's begin our exploration of epilepsy genetics. Epilepsy can have a genetic basis, with certain genetic mutations or variations predisposing individuals to develop the condition. In recent years, significant advances have been made in the understanding of epilepsy genetics. Various gene mutations have been identified, including mutations in ion channels and other proteins involved in regulating neuronal excitability. One notable example is the SCN1A gene mutation, which is associated with Dravet syndrome, a severe form of epilepsy that typically presents in infancy. Other genetic factors, such as copy number variations and gene deletions, have also been implicated in different epilepsy syndromes. Genetic testing can aid in the diagnosis of certain epileptic disorders and may also have implications for treatment and genetic counseling. SPECT imaging, or single photon emission computed tomography, is a valuable tool in the evaluation of epilepsy patients. It can provide information about brain perfusion during ictal, seizure, and interictal, between seizures, periods. During ictal SPECT, a radiotracer is injected during a seizure, allowing precise localization of the epileptic focus. Interictal SPECT, on the other hand, is performed during the seizure-free period and can help identify areas of abnormal cerebral blood flow that may indicate the epileptic focus. SPECT imaging can help guide surgical planning, particularly in cases where resective surgery is being considered. By localizing the epileptic focus accurately, surgical outcomes can be improved, leading to better seizure control and quality of life for patients. Autoimmune epilepsy is a relatively newly recognized entity in the field of epilepsy. It refers to a subset of epilepsy cases where seizures are believed to result from an immune response against the individual's brain tissue. The presence of specific autoantibodies targeting neuronal proteins, such as voltage-gated potassium channels, has been identified in some patients with autoimmune epilepsy. The diagnosis of autoimmune epilepsy can be challenging, as it requires specialized testing to detect autoantibodies. Treatment typically involves immunosuppressive therapies aimed at dampening the immune response and reducing seizure frequency. Identifying autoimmune epilepsy is crucial, as it can alter the management approach, potentially avoiding unnecessary antiepileptic drugs and considering immunotherapy instead. Temporal lobe epilepsy, TLE, is the most common focal epilepsy syndrome in adults and is frequently associated with hippocampal sclerosis, a characteristic pathological finding on brain imaging. Hippocampal sclerosis refers to the shrinkage and scarring of the hippocampus, a region involved in memory and emotion processing. TLE with hippocampal sclerosis often presents with complex partial seizures originating from the temporal lobe. The diagnosis is typically made based on clinical history, electroencephalogram, EEG, findings, and imaging such as magnetic resonance imaging, MRI. Treatment options include antiepileptic drugs and, in certain cases, surgical resection of the hippocampal region. Polytherapy refers to the use of multiple antiepileptic drugs, AEDs, to control seizure activity in patients who do not respond adequately to monotherapy. Approximately 1/3 of people with epilepsy require polytherapy to achieve seizure control. Combining AEDs with different mechanisms of action can potentially improve efficacy by targeting multiple pathways involved in epileptic activity. However, polytherapy also increases the risk of drug-drug interactions, adverse effects, and medication non-adherence. Careful consideration should be given to the selection of AEDs, taking into account their pharmacokinetics, mechanisms of action, and potential side effects. Regular monitoring is crucial to assess drug levels, manage adverse effects, and ensure optimal seizure control. Epilepsy is often associated with psychiatric comorbidities, including depression, anxiety, attention deficit/hyperactivity disorder, ADHD, and psychosis. The relationship between epilepsy and psychiatric conditions is complex and likely multifactorial, with shared genetic, neurobiological, and psychosocial factors playing a role. The presence of psychiatric comorbidities in epilepsy can significantly impact patients' quality of life and seizure control. Therefore, it is important to recognize and manage these comorbidities adequately. A multimodal approach involving pharmacotherapy, psychotherapy, and lifestyle modifications is often necessary to address both the epileptic and psychiatric components. Epileptogenesis refers to the process by which a normal brain undergoes changes that lead to the development of epilepsy. Understanding the mechanisms underlying epileptogenesis is crucial for the development of new therapeutic strategies aimed at preventing the onset of epilepsy or modifying disease progression. The epileptic focus refers to the area of the brain where seizure activity originates. Identifying the epileptic focus is vital for surgical planning and consideration of focal treatments such as neurostimulation. Electroclinical evaluation, neuroimaging techniques, and advanced electrophysiological studies, including intracranial EEG recordings, can help in localizing the epileptic focus accurately. The ketogenic diet is a high-fat, low-carbohydrate, and adequate protein diet that has been used to treat refractory epilepsy for nearly a century. It induces a state of ketosis, where the body utilizes ketone bodies as an alternative energy source instead of glucose. The exact mechanisms of action underlying the anti-epileptic effects of the ketogenic diet are not fully understood. The ketogenic diet is primarily considered in cases of drug-resistant epilepsy, particularly in children. It may be effective in reducing seizure frequency and improving seizure control, potentially leading to a reduction in anti-epileptic medication. However, its strict dietary requirements and potential side effects must be carefully considered and monitored. There is a bidirectional relationship between epilepsy and sleep disorders. Epilepsy can disrupt sleep architecture and lead to sleep fragmentation, while sleep disorders can lower the seizure threshold and increase seizure susceptibility. Common sleep disorders observed in epilepsy patients include sleep apnea, periodic limb movement disorder, and insomnia. Managing sleep disorders in epilepsy patients is essential as it can have a significant impact on seizure control, daytime functioning, and overall quality of life. Treatment of underlying sleep disorders may involve continuous positive airway pressure, CPAP, therapy, medications, and sleep hygiene practices. Neurostimulation techniques, such as vagus nerve stimulation, VNS, deep brain stimulation, DBS, and responsive neurostimulation, RNS, have emerged as potential therapeutic options for refractory epilepsy. These techniques aim to modulate abnormal brain activity and reduce seizure frequency. VNS involves the implantation of a device that delivers electrical stimulation to the vagus nerve, leading to reduced seizure activity. DBS involves the implantation of electrodes in specific brain regions involved in seizure generation, with electrical stimulation tailored to each patient's individual needs. RNS involves the implantation of responsive electrodes that detect and abort seizure activity through electrical stimulation. Febrile seizures are convulsions that occur in young children during high fever episodes. Most febrile seizures are benign and do not cause long-term neurological deficits. However, a small subset of children with prolonged or focal febrile seizures may have an increased risk of developing epilepsy later in life. Identifying children at risk for febrile seizures and providing appropriate education and support for parents is crucial. While most children with febrile seizures do not require long-term anti-epileptic medication, close monitoring and follow-up may be necessary to detect and manage any subsequent epilepsy development. Epilepsy commonly co-occurs with developmental disorders such as autism spectrum disorder, ASD, and tuberous sclerosis complex, TSC. In ASD, epilepsy occurs in approximately 30% of individuals, making it one of the most prevalent comorbidities. TSC, a genetic disorder characterized by the formation of hamartomas in various organs, also frequently presents with epilepsy. The management of epilepsy in individuals with developmental disorders requires a multidisciplinary approach, involving neurologists, developmental pediatricians, and other specialists. Careful consideration must be given to potential drug interactions, behavioral challenges, and the impact of seizures on cognitive development and quality of life. Epilepsy is a complex neurological disorder with a wide range of manifestations and underlying etiologies. The understanding of epilepsy genetics, diagnostic imaging techniques, comorbidities, and treatment options is essential for healthcare professionals. By recognizing the genetic factors, utilizing advanced imaging techniques, managing psychiatric comorbidities, and implementing various treatment modalities, physicians can significantly improve the lives of individuals living with epilepsy. Continued research and advancements in these fields will further enhance our ability to diagnose, treat, and manage epilepsy effectively.